Good evening. Welcome back to Time Waits for No One. Many studies draw the same disturbing conclusion. Americans are not winning their battle against obesity. Obesity is becoming an epidemic in the United States. More than 35% of the adults are obese. Obesity is leading to medical conditions like heart disease, stroke, diabetes, and even certain types of cancer. Obesity is the reason that the current generation of youth is predicted to live a shorter life than their parents. Ohio is considered one of the leading states in obesity. Last 10 years, much can be done to reverse the epidemic. Yet important opportunities to tackle obesity at the national policy level, including changes that enable more Americans to eat healthy and be active, as well as those to provide appropriate medical treatment for patients, have gone largely unmet. Today, our goal is to explain obesity and options of treatment to you. Today, we will visit the issue with one of the experts in weight loss, medical and surgical management, Dr. Matthew Fourman. Welcome back. It's my pleasure to welcome today in our show Matt Fourman. Dr. Matt Fourman, he is a specialist in obesity. He is a surgeon who we are so excited to have him in town to do a specific procedure, specific service to our community in Northwest Ohio. And welcome on board.
Thank you. It's good to be here.
Thank you very much. Today we are concentrating on obesity. And that definition, it's epidemic. Everybody hear about obesity, about children obese, about the adults who are obese. And really we want to educate the public, educate the patients about this subject. And we're going to start by defining obesity. So what's the definition of obesity in your opinion?
Well, obesity is technically classified by what we call the BMI, or the body mass index. And in order to be classified as morbidly obese, you have to have a BMI greater than 35. When we start getting into those higher BMIs is when we see an elevation of some of the other medical problems, the diabetes, the high blood pressure, the sleep apnea, and that's where the real danger of the disease lies. It's not all about the weight, it's about the other medical problems that go along with it. And that's when the field of bariatric surgery can come and help, because we can help solve and cure some of those problems.
So if we define the severity of obesity, I mean, to my understanding, obese, like morbid obese, who are more than 35 BMI.
Correct.
What about between 30 to 35 and 25 to 30?
So class 1 obesity starts with a BMI of 30. So 30 to 35 is class 1, 35 to 40 is class 2, and then class 40 or BMI of 40 or above is considered class 3 or severe obesity. The 25 to 30 is considered the overweight category, and then under 25 is what we consider a normal BMI.
Okay. Now, most of the people, when they are told you are overweight or you are obese, they take it so personal.
Absolutely.
I mean, can you tell me why those patients should take it more serious, not take it personal, and try their best to lose weight and try to do the exercise the way we instruct them? I mean, just why?
Well, I think part of it is the way that we as healthcare providers address our patients. We have to be empathetic and realize that this is a problem that a lot of Americans struggle with. And I think what we need to focus on as healthcare providers too is not just the number on the scale. It's the health problems that go along with being overweight or being obese. And I think if patients think more in that sense as what other medical problems do I have because I am overweight, it's a little bit more motivating to work and to try to get the weight down, because you're not just fighting weight, you're fighting off diabetes, you're fighting off high blood pressure, high cholesterol, those other medical problems that really are the real danger.
Now the question which is most of the patients ask, how much weight I should lose if I need to lose weight? Is it defined based on the BMI, or really the slow weight loss, educational plus dieting plus exercise plus the end result is the surgery?
Well, my personal opinion is that there's not one magic number for everybody. So I don't, somebody at a BMI of 28, they just need to get down to a BMI of 25. It's really more about their overall health picture. So what does their cholesterol look like? What is their blood pressure? What's their blood sugar? So I don't say everybody needs to get to this weight. It's more of an individualized approach where does their particular body, where is it happy? You know, where are they healthy? And that's really what we're shooting for, is more of a healthy lifestyle, healthy eating, and regular exercise regimen, and it's just an overall picture of health as opposed to just a number on a scale.
So the first recommendation, I have no doubt you tell the patients about dieting.
Absolutely.
So, and there is plenty of dieting around
Correct.
the nation. So what's your recommendation, your program, which is we are so excited to have? What is your recommendation at this point diet-wise?
Well, here at Mercy we have a variety of weight loss options. We do have a medical weight loss program in which we put people on specific meal replacements. Those are for people who need to lose a fair amount of weight.
Sure.
When I talk to somebody who needs to lose just a little bit of weight, or when I'm talking to somebody who's going to be having surgery, I don't put them on a specific diet. The problem with a lot of these fad diets that exist is the yo-yo effect. So you get on a diet, you do everything right, you lose 10 pounds, but those diets are unsustainable. You can't stay on these diets forever. And what happens when you go off the diet? You not only gain the 10 pounds back, but then you gain 15 pounds. And people get on this roller coaster for years where they're dieting, and at the end of it all, they weigh 15 or 20 pounds more than when they started. So what we do here is we don't put people on diets, we teach them how to eat properly. I teach them proper nutrition. The way that they eat before their surgery is the way that they're going to be eating after their surgery. The quantities change a little bit, but the principles are the same. So I don't have a magic diet for anybody. I like to think that we just teach people how to eat.
So is that what we call it, behavioral change?
Absolutely.
Behavioral education, really?
Absolutely.
And how long it takes for the people to change their behavior?
Well, it can take anywhere. Some people pick it up very quickly. Some people it takes 6 months to a year before they really get adapted to their new way of eating. Part of it is commitment. You know, it's not easy. If it was easy to eat properly, we all would do that, and it's just not the case. So it can be difficult for some people to really pick up that new lifestyle. But it truly is, like you said, a lifestyle makeover. We don't just do surgery, we don't just do medical weight loss, we really teach lifestyle behaviors that equal a lifetime of success.
Now, patients, the first thing they come to our offices, they are expecting us to give them pills, which is going to lose weight and cure their problem. When do you start drug therapy for weight loss? Is it in combination with what we are talking about here, or it could be started on its own without it?
It can be started on its own. I'm not a huge fan of weight loss medications. They have a place. They are good for certain circumstances, but it's not a long-term answer because, again, you can't be on those medicines forever as a general rule. And so the problem when you stop those medicines is the weight comes back. And so I think a healthier approach to weight loss is proper nutrition, exercise. We know that bariatric surgery, in addition to proper nutrition and an exercise regimen, is the best way, proven over and over and over again, for sustained weight loss. So weight loss drugs have a place. But in my opinion, it's a very small subset of patients that they work well for.
What kind of procedure we have and you are doing at this point so far so successfully?
Sure. Well, the Cadillac of bariatric surgeries that's been around a long time is the gastric bypass. That has stood the test of time. It's been around for years and years and years. It has been proven over and over again to have the best weight loss, although we do have some other procedures now that are coming close to that same rate of weight loss. But there's no doubt that the bypass is tried and true, been around for a long time. The exciting thing about bariatric surgery now also is not just treating the weight, but we know that we can treat diseases like diabetes, which has gotten a lot of press lately, and we can essentially cure diabetes with gastric bypass surgery. Sure. So that's one of the ones that we offer. The other is the gastric sleeve or the sleeve gastrectomy. That's a little bit newer procedure, but it's been around long enough now that we have some good data. It works very well. The weight loss is very comparable to the bypass. It has a very good safety profile, so it's a very safe operation. My sleeve patients spend one night in the hospital and are basically home the next day. We also have the gastric banding or lap band. We're doing some of those. That's probably applicable to a smaller subset of patients. The weight loss isn't as good as the other two procedures, but again, it can work really well for the right patient. At Mercy, we're now doing a lot of these surgeries robotically as well, which is very exciting, very good technology, works very well. We're having very good success with it. So yeah, we're trying to be on the cutting edge of things, and we're having really good outcomes.
new medicines, new procedures. The more complicated healthcare gets, the more you need a special kind of expert at your side. Sure, Mercy physicians are leaders in using the newest medical technology, but something just as important never changes. A commitment to listening, to understanding, to finding the best option for you. The choice to be in expert caring hands? Choose a Mercy physician. Find yours at mercyweb.org/doctors.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. Small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. The band is positioned around the upper portion of the stomach and then secured using the locking mechanism. A tube attached to the band will be connected to the injection port. The port is used to adjust the band tightness after surgery. An incision is made on the upper abdomen to insert the injection port beneath the skin. The tube is secured using the locking connector on the port. The injection port and tube are placed beneath the skin. The band does not alter your digestive function. Food consumed passes through the digestive tract in the normal route. Your surgeon may tighten the band by injecting saline into the injection port. As the saline is introduced to the injection port, it travels through the tube to the band. The addition of saline to the band creates a smaller upper stomach pouch. This smaller stomach pouch restricts the amount of food you can eat before feeling full.
So can you tell us or give us an idea about some of these minor complications we could face?
Sure. Well, let's start with the lap band. So some of the complications that can happen with that is strictly a malfunction of the actual hardware. You know, there's a band that stays in place, there's a port that is sewn underneath the skin. You can have complications with any of those pieces. The band can migrate or move and it can erode. Now, those are all very rare complications. The lap band has a very good safety profile, very safe procedure, and the lap band actually is an outpatient procedure, so people come in the morning, go home the same day.
Wow.
The sleeve gastrectomy, a little bit more surgery than a lap band. I essentially take about 85% of the stomach out. The big risk that we encounter with the sleeve gastrectomy is a leak. So I use a very sophisticated stapling device to divide the stomach. And there's a lot of staples in there, and when you have that much of a staple line, you can have leaks.
Sure.
The leak rate nationwide anywhere is from 1% to 3%. So it's still a very rare complication. It's treatable. It a lot of times does require a trip back to the operating room, but we know it's there, we look for it, I test for it in the operating room, and I test for it the next day to make sure that we don't have those complications. With the gastric bypass, you still have that risk of a leak because we are disconnecting and reconnecting things in a couple different places. So anytime you're doing that, you can have a leak. Again, I test for it in the operating room and I test for it the next day. Sure. The bypass, because it's it's more surgery, there are some down the road complications that can happen. You can have ulcer disease. We can have some vitamin and mineral deficiencies, which we know about. We check regular labs, we stay on top of those things, but some element of malnutrition can happen with the bypass. But like you pointed out, we sure have come a long way in this field, and so those risks nowadays are much, much lower than they were even 10 or 15 years ago, because this field has evolved so rapidly over the last 10 years.
Weight loss is not as simple as just calorie counts. Eat too many, you gain weight. Eat fewer, you lose weight. It's a behavioral change to adopt three concepts: a reduction in calories intake, fat consumption, an increase in fruit, veggie, and whole grain consumption, and physical activity increase. You need to increase the frequency with at least moderate intensity exercise. Regular exercise is an important part of effective weight loss. It helps to control your weight by using excess calories that otherwise would be stored as fat, as well as boosting your metabolism and lowering insulin level. In addition to helping to control weight, regular physical activity can reduce risk of several diseases and conditions and improve your overall quality of life. Regular exercise can help prevent heart disease, diabetes, high blood pressure, and back pain, in addition to the benefit of preventing osteoporosis in women. And after surgeries for weight loss, it's so important to follow a good exercise program to achieve your goal of weight loss and also to maintain that loss. Let's see what Dr. Fourman thinks. So tell us about this beautiful facility.
Sure, I'd be happy to. Well, in my opinion, you know, we hear about weight regain after surgery. Well, the surgery really didn't work because I gained all the weight back. And in my opinion, that's not a failure of surgery. It's a failure of education. It's a failure of us giving the patients the tools that they need to be successful, which is why this place is here. It's easy to tell somebody you need to eat right, you need to exercise. Sure. People don't, a lot of folks that I see don't understand what that means, and they want to exercise, but they don't know how. And that's what this facility is for. We've eliminated the I don't know what to do excuse, because it's right here. They come and see me, we can walk right out here and I'll show them what to do. I can put them on an exercise program. So we take away that, that barrier that so many people have. The other thing, the reason that we built this place is because the patients that come to see me don't like going to a gym. They don't like going to your traditional workout environment. They oftentimes feel judged. They feel like they don't have any direction. And I wanted to eliminate that as well. And so this is a place just for the Mercy weight loss patients. Sure. It's an exclusive club for them. So we have different areas. We have a cardiovascular equipment area. We have our weight training area. So this is an effort to equip our patients, give them the tools that they need to be successful for the rest of their life. Yeah, we have a lot of patients who tell me that, you know, they can't walk on a treadmill, they can't get on a bike because they have severe knee arthritis or low back arthritis. Sure. We have a few machines here that I like to point them to that actually are no impact. They're in a recumbent position, so there's no pressure on their joints. But what I've done on occasion too is I'll write a prescription for some aqua therapy, because I find a pool is a great tool for some of these folks. You eliminate gravity from the equation, they can get a good workout in, and there's zero stress on the joints.
Really, that's a great point. I want you to, because you are an expert, and I want you to point to each machine we have here about the advantage and disadvantage, you know, because I have no doubt each one of them has some benefit.
Okay.
If you don't mind.
Well, no, for example, so this is a new step device, and this is a good device for upper and lower mobility. This isn't something that you're going to get on and break a huge sweat doing. But for somebody that doesn't exercise on a regular basis and may have, for example, low back pain, this is a very good machine to get on, because you can do upper and lower body mobility. It helps increase range of motion, flexibility, and it just gets them kind of on the path to doing some exercise. And it's something active. It's a way for them to burn some calories without hurting themselves.
Sure.
So this is one example. The other example is just a hand bike. And so this is no lower body whatsoever. It's a recumbent position. You sit there and we can adjust the resistance on this, but this is all upper body. So for somebody that has extreme knee pain or extreme back pain, there's zero impact on those joints. But it's a way to burn calories. You're still working upper body muscles, and it's another option for somebody.
Wow. I'm sure every patient has a profile, and they follow that profile on a regular basis, and you see their progress.
Right.
So what is the fastest success so far you had, I mean, in achieving your goal? Within a few weeks, few months, I mean?
Well, I think that one of the things that I tell my patients is that one way to get discouraged is to set goals that are unattainable out of the gate. So it's much better formula for success if you set short, attainable goals. It's okay to have a long-term goal, but get there in increments. Don't expect to lose 50 pounds every month. It's not going to happen. So if my surgery patients are losing 2 to 4 pounds a week on average over a sustained period of time, I think that's a success.
Good.
Most of the patients are doing that, if not more, and a lot of it is dependent on nutrition and their exercise levels. We know that we can do surgery, and no matter what the patients do, they will lose some weight at first. Then the honeymoon period ends, and if they aren't doing the lifestyle haven't perform those modifications that we advise them to, then the weight loss will slow down or stop altogether. So people that are a year, 2 years out from surgery can often get frustrated with the weight loss, and that's when it's really important to have them reset their sights, reset their goals, get them back on an exercise program, and we can help them do that here as well. But really, as far as success, that's defined on an individual basis. Most patients, though, any sustained weight loss is a success to them because they've tried other things and the weight comes off for a short period of time and then it comes back. So when they see themselves consistently losing weight months and months and months at a time, they're thrilled.
Starting age of treatment here in this center?
So for surgery, it's 18 years old.
Okay.
Now, Mercy, in their quest to treat this disease in a comprehensive manner, is starting a childhood obesity treatment center, and we are looking to start that in January. That's also going to be housed right out of this facility, and we're not going to be doing surgery. We're not going to be doing adolescent or childhood surgery, but we are going to be doing lifestyle makeovers, lifestyle changes, behavior changes, a mental therapy component, nutrition component, an exercise component, and then we've partnered with a couple Mercy pediatricians that are going to be involved as well. So the childhood obesity epidemic in this country is staggering as well, and so we are going to try to address that at a young age too, and we think by just changing some behaviors early, we can help stave off the disease as they grow into adult.
Are you excited to be here?
I'm very excited. This has been a fun ride so far, and we love the city of Toledo, and Mercy has been wonderful, and we're very happy to be able to offer this service to our patients here.
And we are very happy and to have you in town and to serve this community, which is really our goal in this program.
Absolutely.
And we thank Mercy that they were able to bring you to this town. We really appreciate it. Thank you so much.
Thank you. Hi, so today we're going to actually be talking with two of my patients. This is Heather. And Heather, why don't you tell us what surgery you had and how far out you are from your surgery?
I had the gastric sleeve surgery about 3 weeks out.
Okay. And how you feeling?
Feeling good, feeling great.
Good. And weight loss is good so far?
Weight loss is good.
Okay. And return to work?
It said about 4 weeks.
About 4 weeks.
I'm off about another week just to make sure I'm on a sure foot.
What made your decision to proceed with surgery?
Well, I talked a lot about it with my family. I've been overweight most of my life. I'm very limited because of my weight. I have a pretty good self-esteem, and I'm a pretty capable professional, but I'm very limited with what I can do physically with my children.
Sure.
I'm limited in my lifestyle because of my weight. I'm limited, and as my children grow, I'm starting to see my behaviors and life choices modeled with them.
Sure.
And I want to make sure that I'm leading the most healthy lifestyle and making really positive.
So one of the things that we really focus on here is the exercise piece of this. So you may say, well, if I have the surgery, why do I need to exercise? It takes the place of exercise, right? And that's a misconception. And one of the ways that we want folks to overall change their life is to incorporate exercise into their daily routine. And so here we try to do that. You can see Heather's here on this elliptical machine. And really, if you want to be successful for the rest of your life, exercise has got to be a priority. So the question that comes up is, well, I don't know. What am I supposed to do for exercise? How long do I do it? What kind of stuff do I do? And that's what I'm here to help you with. So one of the basic ways to get started is low impact cardiovascular exercise. This machine is great for that. It simulates running, but there's no impact on the knees, on the back. How do you feel?
Great.
What made your decision to proceed with surgery?
Actually, I decided to have surgery, and I started going to see specialists quite a bit, different health issues coming up, and I started researching the surgery and realizing that a lot of the issues that was coming up was due to my weight, as well as it was a factor to my weight, and hopefully having this surgery would clear up a lot, and a matter of fact, a lot of things have already started to clear up, and I'm doing wonderful.
And what surgery did you have?
I had the gastric bypass.
And you are how far out now?
2 weeks.
2 weeks. And already off your blood pressure medicine,
Yes.
right? So 2 weeks out from surgery, already off her medicines for her blood pressure.
Yes.
Perfect. And then we can adjust the arm length too. Is the arms okay? So that's one of the other great things about my job is I get to show my patients how to exercise. In addition to being a surgeon, I'm also a certified trainer. I have a passion for exercising, and it's fun for me to help patients achieve their goals when it comes to exercise and weight loss in general. What we have Elizabeth here on is what's called a new step. So again, I guess the take-home message is that surgery is a tool that needs to be used in conjunction with proper nutrition and a good exercise routine. And what we try to do is give you all of those tools. We'll do good surgery, but we also give you the tools to eat properly and to exercise.
Healthcare providers can provide a great service to obese patients by reminding them that their worth is not measured on the scale. Patients should be encouraged to take themselves, their health, and thus their weight seriously, rather than attempting to lose weight so they can like themselves. Reaffirming the patient's self-worth, independent of body weight, is perhaps one of the most powerful interventions a healthcare provider can provide an obese patient. I hope you enjoyed our show today. From all of us here, we wish you a good night. And remember, time waits for no one.